Pharmapal.
Prostaglandins, Thromboxanes, and Uterine Health. Welcome back to our channel. Today, we're diving into the fascinating world of prostaglandins, thromboxanes, and prostacyclin, specifically focusing on their roles in the uterus, as well as the effects of ergometrine and prostanoid receptors. So, let's get started. First up, let's talk about prostaglandins. These are powerful lipid compounds that play a crucial role in various physiological processes in our bodies. In the uterus, they are involved in regulating contractions during menstruation and childbirth. During menstruation, prostaglandins help the uterus contract, which can lead to cramps, commonly known as dysmenorrhea. Dysmenorrhea is the medical term for painful periods, and it's often caused by an excess of prostaglandins. When the levels of prostaglandins rise, they stimulate the smooth muscle of the uterus to contract more forcefully. This can lead to increased pain and discomfort. But don't worry. There are ways to manage this pain, often through the use of nonsteroidal anti-inflammatory drugs, or NSAIDs, which work by inhibiting the synthesis of these prostaglandins. Now, let's shift our focus to ergometrine, also known as ergonovine. This medication is derived from the ergot fungus and is primarily used to manage postpartum hemorrhage and to induce labor. Ergometrine works by stimulating the uterine muscles, causing them to contract. This is particularly useful after childbirth to help the uterus return to its normal size and to reduce bleeding. It's important to note that ergometrine is effective in augmenting uterine contractions, but it must be used carefully to avoid excessive contractions that could lead to complications. So, how do these compounds work? They interact with specific receptors in the body known as prostanoid receptors. These receptors are divided into several types, including the EP, FP, IP, and TP receptors, each playing unique roles in uterine function. For instance, the FP receptor is highly expressed in the female reproductive tract and is primarily activated by prostaglandin F2 alpha. When this receptor is stimulated, it leads to strong uterine contractions. This is why prostaglandins are often used to induce labor. They help prepare the uterus for childbirth by making it more responsive to oxytocin, another hormone that promotes contractions. Now, let's circle back to dysmenorrhea. The treatment options for this condition can include NSAIDs, which reduce prostaglandin synthesis, and hormonal therapies that can help regulate menstrual cycles and reduce the severity of cramps. As for parturition, or childbirth, the balance of these prostanoids is crucial. Prostaglandins and thromboxanes help coordinate the contractions of the uterus, ensuring that labor progresses smoothly. However, it's important to remember that while prostaglandins are beneficial, they can also have side effects, such as nausea, vomiting, and diarrhea. This is why medical supervision is essential when using these medications. In summary, prostaglandins, thromboxanes, and ergometrine play vital roles in uterine health and function. Understanding these compounds and their receptors helps us appreciate the complexity of reproductive health and the management of conditions like dysmenorrhea and labor. Thanks for joining us today. If you found this video informative, don't forget to like, subscribe, and hit that notification bell for more content on health and medicine. Until next time, take care.
Pharmapal.